You're watching Medical News Network, your trusted source for the latest in medical news and information. I'm Mike Wittgenstein, and thanks for joining us. On today's show, we take a very special look at two conditions that affect the lives of millions of people. TMJ, the dysfunction of the jaw joint that's been shown to cause migraines, neck pain, back pain, and has recently been related to asthma and high blood pressure. And sleep apnea, a condition that until the recent death of Green Bay Packer All-Pro lineman Reggie White had gone about its business in relative obscurity. So if you, a loved one, or a family member are fatigued, tired, have headaches, maybe some other medical condition that no doctor's been able to explain to you, then my advice is stick around. You won't want to miss what our guest has to say today.
Welcome to an educational and comprehensive discussion with today's top medical experts. Your trusted source for the latest in medical news and information. You're watching Medical News Network.
Welcome back. We're very pleased to have in studio today Dr. William Adams. Dr. Adams is a member of the American Academy of Craniofacial Pain and the Academy of Dental Sleep Medicine and is a recognized authority on the treatment of TMJ and sleep apnea. Dr. Adams, welcome to the show.
Thank you for having me.
All right, before we get into our topics today, I just want to ask you, if you find that a lot of times I interview doctors all over the country, and when I went to find somebody to interview on TMJ and sleep apnea, it surprised me that your name, a dentist, kept coming up. Do you find that most people don't realize that a dentist is probably the best person to treat these conditions?
You're probably correct. Most of the time you go to your physician for your headache. They don't think about relating to their jaw joint. They go to their physician because they don't sleep well. They don't think about a dentist as being adjunct to the sleep doc so that they can get proper treatment.
Okay. Tell me a little bit about why you decided. Now, you belong to two groups that are very specialized groups that deal with TMJ and sleep apnea, very select group of professionals. Why did you decide to pursue this avenue of treatment?
Because there's so many people out there who do not receive the appropriate medical care for their headaches. And when they have sleep apnea and can't tolerate their CPAP, they're kind of left in limbo. They don't know where to go. They don't have another choice, or at least they don't think they have another choice.
All right. I came out to your office, as I do with everyone before I bring them on, to verify that what I heard about you and what I saw was going on. So before we get into too much more, let's take a quick look at your office. I found your office to be, most doctors' offices I go into are bright white walls, bright fluorescent lights, linoleum floors. Your office seemed to be a little bit more homey, so take me through a few pictures here real quick.
Okay, this is our reception room. It's kind of a big room. We had taken an older house and renovated it for our dental office, and it's spacious, and hopefully patients find it comfortable.
The colors are very soothing. And then I noticed down the hallways, you have earth tones, you have very pleasant stuff. Do you find that most patients like that better than the stark white walls?
I certainly hope they do, because it's a lot more comfortable working there.
All right, we have a lot to cover today. I interviewed quite a few people. I want to have time to show the interviews. Tell me a little bit about what is TMJ?
TMJ, that's a really difficult subject to answer in a short period of time. You have a condyle that sits at the base of your skull.
All right, we're going to bring up a picture here real quick.
All right.
All right, now we can see they're labeled. The condyle is basically your lower jawbone.
Mm-hmm.
All right,
and there's a disc that fits on top of that, and then there's a skull that fits under top of that. When those function together, it ought to ride kind of like a saddle on a horse. It should move smoothly. There are times when that disc starts to wobble around and not fit smoothly. And then there are times when that disc gets locked in front of the head of the joint, and you can't open, and it's intense pain right in front of the ear.
All right, we're going to put up the second picture. And now you can see the disc is moved forward and the jawbone is compressed back. What sits behind that jawbone?
Nerves and blood vessels.
That go to?
The head and neck.
Everywhere?
Everywhere.
All right, you brought a little video. We're going to take a look at the video real quick, and maybe you can tell everybody kind of what goes on here. Now, this is just a normal TMJ joint, right? The red line shows where they lined up. What is the yellow?
The yellow is the disc that fits on top of the head of the joint.
Okay, and then under normal conditions, it just slides back and forth.
just like a saddle on a horse.
Okay. And then what starts to happen? Does the disc start to slide forward?
It can slide forward and toward the inside. It kind of gets wobbly.
Right. Just like we're seeing here. Is that when you start to get that pop?
You could have a pop at that time, certainly.
All right. And then eventually
the disc gets totally dislocated, as it did just then, in front of the head of the joint, and that puts a lot of stress on those nerves and blood vessels in the back and causes intense pain.
All right, we're going to bring up, because of time constraints, we're going to bring up and look at the first video of a lady that she's the organist, I understand, at your church, had sought treatment from a lot of people. Well, let's hear what she has to say real quick.
I was having a lot of neck problems, a lot of pain in my neck, and I had a lot of, my jaws locked up when I ate. I would have a lot of pain. I was having headaches. I've seen chiropractors for years. I've seen doctors, and they say exercise more. There's just nothing that they've ever really done other than adjust me. There again, I was one of those people that was a little skeptical. I didn't really believe it till I saw some people, actual patients that he had that he had made appliance for that were just totally improved. And the headaches are gone and the pressure pain's gone. If more people knew, and I tell people all the time, because I was one of those people. I thought it was a gimmick. I didn't think there was anything to it. I have seen people that he has treated, and it's just almost like a miracle. And it's unreal what he's doing with these appliances for people. I wake up in the mornings, I feel better, my neck's not all, I'm not doing this number all day long. One thing about TMJ is it's not related like what you would think. It is a pain-related thing in the jaws and the face, the neck, the back. He's wonderful. He's very sociable. He talks with you about your problems and finds out the core of what's going on. And staff is great. I mean, they always speak. They're always friendly. I can call them up, talk to them, anything. Mr. Green, David Green, I'm the organist at the Episcopal Church where Mr. Green attends. He would come down the aisle, barely get down the aisle with a walker or a cane. He came to see Dr. Adams. Dr. Adams made an appliance for him. When he put it in, the man literally got up and walked down the hall by himself with no cane, no nothing. He's actually unstoppable now. Anybody could see the before and after of David Green. They would be lined up out in the parking lot to get in here and try to get an appliance.
Okay. Obviously, she's in good shape. She takes good care of herself. Had headaches, had neck pain. Nobody could help her. She mentioned Mr. Green that we're going to look at in a minute. Do you find a lot of people that come to see you have had problems, have been to other doctors and haven't been helped?
Most of them have been to several physicians, sometimes as many as 20 or 25, searching for the answers to why they're having their pain.
And they come to you, and most of them don't even know what TMJ or TMD is?
Most of them have not a clue as to what is going on.
Okay. She mentioned David Green. Now, I had the pleasure of meeting Mr. Green. I want to say before we show his clip, he had fallen over a wheelbarrow, running out his back door to check on a noise. And until I talked to him, I thought, oh, he fell over the wheelbarrow. He hadn't been able to run out his back door for 20 years. He'd been walking with a cane.
Walking with 2 canes. He looked like death warmed over before we treated him, and there were people that really thought he was almost terminal at that point.
He has Parkinson's. Yes. He said to me, without a doubt, your treatment has helped him with his Parkinson's. Didn't say it cured it, it just said it made it better. Do you find that you can help people with diseases that everybody else tells them it's...
Anytime you've got a neurological problem and you have a joint dysfunction, if you correct the joint dysfunction, the other problem is much more easy to handle.
All right, let's listen to what Mr. Green had to say.